What if your body was trying to warn you about breast cancer long before you realized something was wrong? Every year, hundreds of thousands of people are diagnosed with breast cancer, but many lives are saved because it was found early. Knowing the warning signs, understanding your risk, and getting screened can make all the difference. In today's video, we'll explain the different types of breast cancer, important statistics, common symptoms, risk factors, prevention strategies, treatment options, and reconstruction surgery after breast cancer. Stay with me until the end because this information could help save your life or the life of someone you love. What is breast cancer? Breast cancer occurs when abnormal cells in the breast begin growing uncontrollably. Over time, these cells can form a tumor and may spread into nearby tissues or other parts of the body if left untreated. Although breast cancer is much more common in women, men can also develop breast cancer. Because many men don't realize they're at risk, diagnosis is often delayed. Fortunately, advances in screening, surgery, chemotherapy, radiation, hormone therapy, targeted treatments, and immunotherapy have dramatically improved survival rates over the past several decades. Key breast cancer statistics. Here are some important facts. Breast cancer is one of the most commonly diagnosed cancers worldwide. In the United States, approximately 1 in 8 women will develop invasive breast cancer during her lifetime. Thousands of men are also diagnosed each year. Early-stage breast cancer has a very high survival rate, with many people living long, healthy lives after treatment. Regular mammograms and early detection continue to save countless lives every year. These numbers remind us why awareness and screening matter. Types of breast cancer. There isn't just one kind of breast cancer. Ductal carcinoma, in situ, DCIS. This is considered a non-invasive cancer. The abnormal cells are located inside the milk ducts and have not spread into surrounding breast tissue. DCIS is often highly treatable when discovered early. Invasive ductal carcinoma, IDC. This is the most common form of breast cancer. It begins inside the milk ducts but breaks through the duct wall and spreads into nearby breast tissue. If untreated, it can spread to lymph nodes and distant organs. Invasive lobular carcinoma, ILC. This cancer begins in the milk-producing lobules. Unlike some breast cancers that form a distinct lump, ILC may grow in a more diffuse pattern, making it harder to detect on physical examination. Triple-negative breast cancer. This aggressive subtype lacks estrogen receptors, progesterone receptors, and excess HER2 protein. Because of this, hormone therapy and HER2-targeted medications are not effective, so treatment often relies on chemotherapy and newer immunotherapy approaches. HER2-positive breast cancer. These cancers produce excessive HER2 protein, causing rapid cell growth. Fortunately, targeted medications have significantly improved outcomes for many patients with HER2-positive disease. Inflammatory breast cancer. This is a rare but aggressive form. Instead of forming a lump, it may cause redness, warmth, swelling, tenderness, and skin thickening that resembles an orange peel. It requires prompt medical evaluation. Metastatic breast cancer, also called stage 4 breast cancer. The cancer has spread beyond the breast to organs such as the bones, liver, lungs, or brain. Although metastatic breast cancer is generally not considered curable, many newer treatments can control the disease for years while helping maintain quality of life. Signs and symptoms. Breast cancer doesn't always cause pain. Some people have no symptoms at all. Possible warning signs include a new lump in the breast or underarm, thickening of breast tissue, swelling in part or all of the breast, changes in breast size or shape, dimpling of the skin, redness or warmth, nipple pain, nipple turning inward, bloody or unusual nipple discharge, persistent breast pain, swollen lymph nodes under the arm or near the collarbone. Any new breast change should be evaluated by a healthcare professional. Risk factors. Some risk factors cannot be changed. These include increasing age, family history. Certain inherited gene mutations such as BRCA1 or BRCA2, previous breast cancer, dense breast tissue, early menstruation, late menopause. Lifestyle factors may also increase risk. Obesity, lack of physical activity, heavy alcohol consumption, smoking. Long-term hormone replacement therapy in some individuals. Having risk factors does not mean someone will definitely develop breast cancer. Likewise, many people diagnosed have no obvious risk factors. Can breast cancer be prevented? There is no guaranteed way to prevent breast cancer, but you can lower your risk. Consider these healthy habits. Maintain a healthy weight. Exercise regularly. Eat a diet rich in fruits, vegetables, whole grains, and lean protein. Limit alcohol. Avoid smoking. Breastfeed if possible, as it may slightly reduce risk. Know your family history. Follow your healthcare provider's recommendations for mammograms and other screenings. Women at very high genetic risk may discuss preventive medications or preventive surgery with their healthcare team. How is breast cancer diagnosed? Diagnosis usually involves several steps. Your provider may recommend. Breast cancer is one of the most researched cancers in medicine today, and treatment continues to improve every year. The most important message is this: know your body. Don't ignore changes. Keep up with recommended screenings. Early detection saves lives. This video is intended for educational and informational purposes only and should not be considered medical advice, diagnosis, or treatment. Always consult your physician or another qualified healthcare professional regarding any symptoms, medical condition, screening recommendations, or treatment decisions. Never ignore professional medical advice or delay seeking care because of something you heard in this video. If you found this information helpful, please subscribe, follow, like, leave a comment, and share this video with your family and friends. You never know who might benefit from this life-saving information. Thank you so much for watching, and until the next video, stay informed, stay healthy, and take good care of yourself.